To have a naloxone shortage is absolutely terrifying. More and more people are going to die.
The province says it will be a few weeks until a short-term supply issue around the life-saving kits carrying naloxone will be addressed. But for some advocates working in the city, they say the issue needs to be addressed not in weeks, but as soon as possible.
Nobody wants to die. So we need it. We need the supply. We need it now.
Jasmine Doolin is the executive director of Jib Stop in the city, which helps people overcome their addictions to meth. She says in the city, the supply of methamphetamine and other drugs is becoming more toxic, increasing risk of overdose, especially during the pandemic.
90% of the drugs out there are not even what they think that they're getting. Ecstasy, fentanyl, meth, fentanyl, cocaine, fentanyl. And when you mix those two, you're probably going to die. And it's terrifying and it's heart-wrenching to think about, but that's the reality of it.
Doolin says the pandemic has also created a more toxic supply of drugs, as the movement of narcotics has also been hindered by COVID-19, creating a dire situation for the supply.
People are resorting to making it in their kitchen sink. People are resorting to throwing different substances in there just to make a buck. And they're mixing deadly substances such as fentanyl and meth together, which is uppers and downers, and that's a cocktail for disaster, for death.
Officials with the Manitoba Harm Reduction Network tell CityNews the city has been dealing with a shortage of naloxone kits for roughly 4 weeks, and now that shortage is hitting the community firsthand. Brothers Pharmacy on Selkirk Avenue say they've been waiting on an order for weeks and have been turning away people on a daily basis. Officials with Manitoba Health say the issue is set to be addressed in the next few weeks, at which time there will be a sufficient stock on hand to fill orders regularly. Manitoba Health also notes that naloxone can be purchased without a prescription at pharmacies, but the kits can be costly. NDP addictions critic Bernadette Smith, however, says the shortage is frustrating and says government needs to do more work focusing on harm reduction to keep drug users safe and save lives in the province.
And we've had families, advocates, people who have overdosed themselves calling on this government to make sure that naloxone is available. During this pandemic, we've seen an 87% increase in overdose deaths. And prior to that, people were, dying of overdoses. These are preventable. There's people dying in this province, and this government, not only our premier, but every single one of those ministers are sitting idly by and doing nothing while Manitobans are losing their lives.
As for Doolin, she says the situation in Winnipeg is getting worse, and it's been compounded by the shortage. She says she's glad the province is working to address the issue and hopes the plan to have it addressed in a few weeks stays in place. As she says, for many, having a shot on hand is literally a shot at life or death. In Winnipeg, Morgan Majeski, City News.